This is the Refinery featuring Free Radical Network, the Party of Choice, and the Conservative Union here on Vigilant Liberty Radio.
Good evening. Finally, it is, what day is this? Tuesday, December 2nd, 2014. This is the Refinery. We are the place where grassroots organizations come together to explore the best ways to make conservative messaging work so that we can reach and influence ever more people. Just FYI, you can always watch us live every 8:30-ish Central Time on the refineryshow.com. That page also has some links for you to listen or download the podcast at Vigilant Liberty Radio. You can watch the YouTube clips that JD and Felicia put together every week. You can see all of our other previous episodes, and if you want to chat with us live during the show, you can do that at the refineryshow.com. And with that, we've got me and Ryan from the Conservative Union, JD and Felicia from Free Radical Network, and Cori and Andy from the Party of Choice. First thing we wanted to talk about today was sort of a new project, Unsurance. And you can tell us your Unsurance stories using the Contact Us link at therefineryshow.com. But Ryan had the story that he told us last week about his Obamacare pricing changes now that his insurance policy had to be canceled because it didn't meet the Obamacare regulations, meaning that people who don't know him and don't know his family say that he had substandard insurance before. So his insurance company had to cancel that policy and get him a new one that provides all the things that Obamacare says you need. And it's working out not all that well for him, and he's far from the only person, but he recorded a nice video telling the story about that, and I think JD's going to mute us and play that video for us here so then we can talk about it. So JD, take it away.
Hi, I'm Ryan, and this is my Unsurance story. My wife and I have 2 children, one of whom was born with a bilateral cleft lip and palate. The private insurance that we have had until the end of this year, when it will be canceled by Obamacare, has had a premium of $553.80 per month. It had a $1,000 deductible and a 20% copay until it reached the maximum out-of-pocket of $3,000 per year per person. We've had great hospitals, great doctors, and our son's care has been in the best hands. Recently, I learned that we can't keep the plan that we've had for years because it doesn't meet all of the added Obamacare regulations. I emailed my insurance agent to ask what options we have going forward. She emailed me a list of 15 plans, the cheapest of which has a premium of $519 a month. Right now, I bet you're thinking to yourself, that sounds pretty nice, that's cheaper than what you had. But here's the important part. It has an $11,000 deductible. That's a total of $17,000 before we can even use the insurance. We can't afford to pay that much each year. My work is also being forced to offer insurance. The monthly premium for me on the work plan is estimated to be less than 9% of my annual income. So, because of this, I won't qualify for any subsidies on the Obamacare exchanges to supplement my high deductible plan. When you add my wife and 2 kids to that plan, however, the premium will be over $800 per month. There's no way that I'll be able to afford that high deductible plan. There's also no way that I'll be able to pay $800 a month in premiums. So unfortunately, the healthcare plan that I'm left with is the ones the Democrats claimed Republicans wanted all along. Don't get sick, and if you do, die quickly. We liked our plan. We couldn't keep it. We liked our doctor. Hopefully we'll be able to keep that, but at this point I don't know. The Democrats lied to us. And because they lied, we are now uninsured.
That's pretty amazing. Ryan, could you, not everybody really understands exactly what, how the monthly fee and the co-insurance or the copay pays for doctor's offices with your maximum out of pocket and the deductibles and how all of that works. So if you could outline that really quickly and then compare last year to this year and how, because those terms are unfamiliar to a lot of people. So if you could outline that really quickly, that would be really cool.
Okay, so each month for our insurance premium, we have to pay a certain amount. It is around 500, it's $553. And then when my son goes to the hospital, in addition to the insurance premiums we've been paying, we have to pay the doctor bill up until you get to his maximum of $1,000. So if his surgery is $20,000, we pay the $500 premium every month, and then we pay the $1,000, and then after the $1,000, the insurance pays for 80% of the bill. We pay for 20% of the bill.
Because that $1,000 is your out-of-pocket is your deductible.
Yeah.
So it's $500 a month just to have the policy, and then you pay the first $1,000 of expenses for the year, period.
Yeah.
And then after that, you only pay 20%.
Yeah, after that we pay 20% until we have paid $3,000.
Okay, and then after that?
And then the insurance covers the rest.
Okay. So that's $500 a month to have it, $1,000 before insurance starts paying anything, and then you have a maximum out of pocket per year of $3,000, and you're paying 20% or 80/20 or whatever it is, but a maximum of $3,000. That was your old plan
per person.
Yeah. Now with the new plan, it is, according to the insurance agent, the cheapest plan is $511 a month. And then that deductible, instead of being $1,000, is now $11,000. So we have.
Okay, so instead of maximum out of pocket of $3,000, you have a minimum out of pocket of $11,000.
Yes.
Okay. Before insurance even pays anything.
Yeah, and then after that, they start paying a portion. And I believe the maximum was $12,800. So we won't do the 80/20 or 70/30 part very long until that hits. But that's still 4 times more than the maximum was under the old plan.
Well, yeah. Yeah, I mean, you used to be able to budget your entire your medical expenses for the year, that it wouldn't be, after your $500 a month or $550 whatever a month deductible, that's fixed, plus $3,000 a year, and that's as bad as it could get. And now you're looking at same monthly expense, but $11,000 a year or $12,000 a year is as bad as it could get, and it's gonna be $11,000.
Yeah, I think when I calculated it a few days ago, the current plan that we paid out of pocket every year with the premium and then the out of pocket amount ended up being around $10,000 a year. And the new plan with the premium and then the $11,000 out of pocket will end up being around $17,000 a year. So just with those, now if I add the maximum, it's going to be closer to $18,000, $19,000. So we're $8,000 or $9,000 more expensive if we use the whole insurance, which with all of his surgeries, they've been expensive enough that we have had to every year so far.
And what about coverage and care for the other things that you do? I mean, do you still have the same level of medical and dental and stuff like that you used to have? That you'll be able to see the same doctors and get the same prescription care and stuff?
I don't know that yet. We haven't applied for policies yet. She just said these are the policies that you can choose from. Let me know which ones. I'll get you applications for them. We'll see what you qualify for. And maybe it will be more expensive once they see our history. I don't know if these prices are final or if they'll go up. So we'll see what happens there.
So your best case is $6,000 more a year?
Yeah. Best case, more likely 7,000, 8,000, 9,000 more a year.
And there's some other subtleties too. If Ryan's son maxed out at 3,000, and then insurance, he spent the whole 3,000 on his expenses, and then the insurance company would pick them up. That's a point where, of course, the other members of the family would, still have to meet their cap and everything. So the original maximum would be if everyone spent all the amount that they had, everyone had that much of medical bills that they had to deal with. In this case, it doesn't matter who's sick. They still have to meet all the deductible of $11,000 before anybody gets covered.
Oh.
Yeah, that's right. So I don't know. since I don't have the actual policies, I don't know if the doctors are covered, and we haven't gone that in depth yet. I did email the insurance agent and just said, wow, everything's more expensive. And she said, yeah, everything is more expensive, coverage is worse. You can thank the president for that. So, I mean, she knows the coverage is worse. That's what she said to me. I don't know specifically how. I emailed her today actually asking why the policy was canceled, what regulations it didn't meet. I haven't heard back yet, but I'll let you know when I do hear back.
Well, and people are really experiencing this across the board right now, especially as new rate plans and new signups people are getting letters like you got, Ryan, and are all having to make the same choices. And that's one of the reasons we wanted to put together the video with Ryan, is to be able to show people everybody has a personal story. And we know we haven't quite got the public moved to a place where they're ready to repeal Obamacare. There's a lot of talk, even in conservative circles in places. Avik Roy comes to mind about repairing as much as possible, and there might have to be some period in which we kind of kludge things together until we can get some political solutions to actually get rid of it and find a way to keep people from falling through the cracks therein. But the emotional stories, the gripping accounts, the people who had insurance and were fine, and they were lied to, and now they're made much worse off. We need to tell those stories, and I appreciate that Ryan went first, and really do encourage people to get in touch with us again if they're wanting some help telling a story like this and putting it out. If we get dozens of these out and start sharing them and using that hashtag uninsurance, things like that, we might be able to get some attention of some people in Washington or some of the larger liberty organizations who I would have expected would have done something like this by now, but get some attention for this issue and get some tools and some ability, some videos to share that will help people talk about this narrative in a personal way.
Absolutely, and there's nothing more powerful than a personal message, a personal story like this, like what Ryan presented. It's really it's an important thing it's an important way to communicate with regular people, because this is something that transcends politics. If you are having some problems with your insurance because of Obamacare, with your health care because of Obamacare, I mean, that's something that people are going to be going through a lot more now, with 2015 rolling around.
And here's what I want the contrast to be. You see the ads, the healthcare.gov ads have been all over the place, again, telling people to sign up and enroll, and little old ladies talking about they got covered for $60 a month. You tell me how that person gets $60 a month? It's because now Ryan is paying a heck of a lot more for a lot less insurance, and that extra money that's going into the insurance company is not going into their pocket. It's going to cover the costs of grandma at $60 a month. And that's an ambitious thing that we should be able to do, is cover grandma. But should we put Ryan and his family and their health in peril in order to do it?
Well, I think most of us understand that the government is the least efficient provider of charity and good products and services for the entire nation that anything that was ever invented. I mean, there's nothing that government does better than the private sector, and we could have chosen with our messed up healthcare system. We could have chosen to go in the direction of greater free market, allowing for the Walmartization of health insurance. Walmart provides good products at good prices and has allowed people in the lower and medium and middle class to have things that, good quality food, easy to obtain, easy to get in their small towns, and it's provided access to the level of wealth that's really never been before seen in human history. And if Walmart had been able to provide health